Okay, there's the first three tips for archaeologists is this. Number one tip, remember it's all about safety. Safety is the most critical aspect when you're doing either an archaeological survey or an archaeological excavation. There are horrible stories of individuals getting buried alive by balks. These are the walls between excavation units, or having terrible slips and falls, or collapsing because of health issues. The number one focus of any principal investigator or a field supervisor is safety. You absolutely have to focus on safety. And no matter if this means taking the safe way to an archaeological site, giving an additional break when people are visibly tired, or just focusing on making sure you tell anyone who's acting unsafe to be safe. That's your critical role as an archaeological leader in an archaeological position. You have to focus on safety. What I do every single morning is I give basically a safety brief to the crew to make sure that they focus. Make sure they don't stick their machetes upright in the ground so if someone comes by they can lacerate their foot. No, you put the machete straight on the ground, on the flat side. That's one critical aspect. Also, don't leave your shovel sticking up so someone can lacerate their foot. Put the shovel end down to protect yourself. Also, don't leave your trowel, your sharpened trowel, lying around so someone can step in it. The second issue, the second tip for an archaeologist is to focus on health issues. You're hiring individuals. The most critical thing is these people are healthy. Remember, you're taking them across usually 10-mile, 5-mile hikes every single day of steep terrain, or in blazing hot sun, or in very cold environments. So the focus should be is the crew has to be healthy enough to be able to participate in an archaeological job. This means a very thorough evaluation. Make sure that they're not suffering from diabetes or have heart problems or something that could really cause them a horrible misfortune when they're on an excavation or when they're especially on a survey. Now, in excavation, you can be more reasonable in terms of allowing more people to join, but not on an archaeological survey. You have to focus. Do they have a history of health disease? Do they have a history of diabetes? Do they have a history of ankle or knee problems? You don't want them collapsing. You don't want them extending a knee during an archaeological survey. The third aspect the third tip for archaeologists is to focus on stretching. How many individuals have pulled muscles or pulled ligaments or have knee problems? And it could have been cured by the simple aspect of just stretching. Making sure, we've all done some type of sports before. Make sure that they touch their toes or make sure that they stretch their calf muscles or their thigh muscles. Just make sure that you do stretching so that no one pulls any type of muscle. Okay, let's go to the next slide. Thank you.